And this is very interesting for me because maybe I'm female, but body mineral density level improved a lot for both male and female. But look at the female; it's like dramatically improved for femur. It improved a lot for spine, and then weight loss. So I think it's more impactful for female for bone density, which is very promising. And then we talked about heart rate. And then another interesting thing is the autonomic function of the paralytic patients is very poor. But this is not significant improvement, but it shows the promise of the bladder capacity increase after using 2 or 4 months of the power gait orthosis. So I thought I was excited. And this is not as important as like in general overall health, but this is like engineers, we want to see how patients is improving their gait as a velocity and step length and things like that. It improved definitely, like, but it was very expected results. So for the conclusion of this research was with the fuzzy control for power gait orthosis, it helped overall patients' health, reduced cholesterol, BMI, and urinary symptoms and body fat mass. And increased bone density and bladder capacity was very surprising, and improved the heart and muscle strength. So that is it. Oh, how is the time? That's good. Yeah. Any questions?
Yeah, I have a bunch. If
Yeah.
that's yeah, 'cause as you can imagine, this is not my field, so a lot for me to understand. But first of all, thank you for that presentation. That was a really good way to summarize that in a way that I could understand, and I've never done any form of engineering, so thanks for that. Um, is there any like what patients could like qualify for this? Are you in any plans of like working with a company to get this like to patients, or is that far down the line, like 10, 15 years still?
Yeah. So this research has funded by Samsung and rehabilitation centers. So the product is made. I don't know how they want to commercialize this, to be honest, because um, medical device companies also want to make money because they are companies, profit companies, and it is still expensive. So we need to reduce the cost down first of all. But anybody can get benefit out of this, even they are not injured or paralyzed or anything. Even patients who are weakened from long term bed rise or
Like for
uh,
recovery kind of
yeah,
thing?
like a surgery. That will be my next topic if I have a chance to present. I made another device for this for the cardiovascular disease patient.
That would be
But
one. Yeah.
yeah, so the possibilities are unlimited. But I think first of all is like, okay, how much of the device that people can afford.
Hmm.
Long time ago, like when I developed this prototype, the battery technology was not that good. But now our battery technology is really good. So even light and compact battery size and weight will make this device even more possible to wear it all the time for the people who have a difficult of the mobilization.
That's very, you actually answered like three of my questions there, because I was gonna ask about like battery or if people had to charge it every single day or if that was a challenge. Could you talk about any other challenges you face? Like, is there one part that seems to break before others, or are they expensive or difficult to have fixed if they have a problem? Are there any like environments won't do as well, like when it's cold or something, or
Yeah, so that's a good question. So a lot of a paralytics patient, they have a different body size. Depends on how long they had symptoms. So uh, for Asians, they have little, smaller than, like African Americans or, Europeans, it in terms of the height and weight. So the device is has to be personalized right now. So the prototype that I made is actually like formed by my body side. I have to make a mold of my body side. So that's another challenge that, okay, how the cost is high because they personalize the device.
oh, every single one to every
Every
single
single
patient?
one, the frame needs to be fit by the by individual.
Oh
So
wow, because yeah, I was looking at your initial one and it looked like it had some adjustable parts from, thigh to or hip to knee and knee to foot, but
mhm.
even
So
then
let
it
me
has to be worked on more.
yeah, so let me show you which
Yeah,
part
that
need to be
one.
molded. So
Yeah,
this
definitely.
hip, yeah, this hip part need to be molded.
Oh wow.
This one, yeah, this one it can be shortened and lengthened. We have a multiple, positions that we can adjust. But we learned that this has to be molded personally because if you have a huge gap,
Mm,
your body cannot utilize or maximize the potential of the device.
right. Yeah.
Yeah, and then your body start like trying to create another unnecessary movement to compensate the gap between this
Right. Right.
yeah, so that's the challenge. And in order to make it lightweight, we try to minimize all these accessory parts that like this adds a weight, this metal part that added weight. So instead of the metal, we want to use carbon fiber. And
Okay.
carbon fiber, you have to bake it. Like carbon
Oh,
fiber, yeah, it's like a fabric, but once you bake it, it's like firm. Like you cannot make a drill because it's very fragile. So
I
that's
see.
another challenge. Yeah.
And then a lot of orthotics and all that seem to struggle with like pressure ulcers, especially when they're not fitted exactly well. Have you
Mhm.
experienced that at all with any of your patients?
Oh no, we didn't experience any of it because they are not wearing it 24/7. They want to wear this when they want to move around or having an exercise.
Okay. Oh, okay. So it's more for specific. And
Exactly.
yeah, and my last question was just speaking on those patients. I saw patient A, B, C. Was your study with those three patients only, and are there like plans to do like a larger scale study with, 300, 500 patients? Although I imagine it's hard to find that many paraplegics and make that many of the machine, but
Yeah, that's a good question. So the reason why we cooperated with the rehabilitation center because they're the center that all the paralytics patients come,
okay, yeah.
and get treatment. But we cannot find a lot of patients who are excited to participate in the research because
Really? Oh wow.
yeah, because they're very like depressed.
Oh, I see. I see.
Yes, so we have to work on their psychological issues first, and then they are trying to, like bring the topics up, like for oh, you're young, like let's try to do something. And I don't know, you notice it, like our subject are fairly younger, like
Oh, I see.
37,
Yeah. Oh yeah,
41,
37. Wow.
yeah, like 27, like 21,
21.
25.
Oh, poor patient that
Yeah,
was.
so we wanted to try for like older patients, but it was not possible to recruit a lot of elder patients
Yeah.
because of that.
Yeah, just
Yeah.
looking at your study, I can think of 1,000 more studies to do. I mean, maybe that will improve their mental health too, just having this device. Uh,
Yeah, I that I agree with you personally, but not
Yeah,
many
that's what I was
people.
gonna ask actually. Is there any like any studies or like do you know about the mental wellness benefits from a device like this? Because I could tell you a story. So
Mm,
when I tore my Achilles on the island, Philippe, you know this.
mm.
I tore my Achilles on the island, and coming back, I was on crutches. It was really hard to like be alone and like adjust here in Warner Robins. I was like, I can't do groceries by myself because I need crutches. I'm like, how do I even push the cart and stuff like that? And I actually bought like a special device, a special crutch, which is kind of like a peg leg, that attaches to my leg, and I was able to walk while with the torn Achilles without my crutch or like crutches my hands
Oh
and
my
stuff.
God.
Having that independence definitely boosted my like mood. Let it allowed me to be like just be able to do function normally. I was wondering if you happen to know if this benefited your sub or if you have any data about the mental health of the subjects you studied with this
Yeah,
device.
I don't have the exact data following my patients, but I also read a lot of papers that they do the aqua aerobics with the paralitics that they try to exercise. They improved a lot of the psychological, um, like symptoms, and they got a lot of benefit for coming out of the depression and things like that. So I definitely, and also we know, we know that the exercise improves your mood, right?
Yeah.
So I think that definitely, I think that would be interesting topic to study. Thank you for
Are you
mentioning
still
it.
working on this device or
No,
on the team, or did you pass it on to someone and they'll do those?
so yeah, it's like I passed it on to someone else like a long
Oh,
time
that's too
ago.
bad. I feel like you were really important in that development. You could
No, I'm
definitely.
not. I'm not that important. No.
That seems pretty important. Yeah. Well, I mean, never too late to jump back in. But
Yes,
yeah, those are all my
absolutely.
questions. Thank you.
Yeah, you're welcome. Very good questions.
That's pretty much it from my end in terms of questions. I mean, is there anyone else who has any questions who is currently here right now in this meeting? Here. Otherwise, we could pretty much just wrap it up. It was a really, really interesting presentation.
Oh, thank you for listening and thank you for coming and make this thing happen because I didn't advertise and you guys didn't advertise either, which is thankful.
So, we'll definitely spread the knowledge. I mean, this is important, like something to think about as future physicians, how we're able to optimize patient care, and this is definitely something that needs to be spread around among students, you know.
No, I think it would be very interesting in the future medicine because it would be interesting era because a lot of the technologies coming out, mobile technology, wearable technology, like, and we have to know these things because the people gonna use it, So, and applying this technology, applying this device to the patient, right patient, I think it will maximize the benefit. So, thank you for listening. Thank you for questions and feedbacks.
Perfect. Alrighty, thank you for doing this
Yeah, can't
presentation.
wait for your next one.
Mhm.
That's
Next
Perfect.
one, yeah. Let me know if you don't have any presentator lined up.
Yeah,
I'll do it again.
no worries. Alrighty, we're just gonna wrap it up for tonight. Thank you everyone for attending.